Hey guys, it's Medicosis Perfectionalis one more time, continuing our series of lectures on fluids, electrolytes, and acid-base disturbance. We have talked about the normal physiology of the proximal convoluted tubule before, as well as its world-renowned enzyme called the carbonic anhydrase. But today we'll discuss carbonic anhydrase inhibitors. It's gonna be a difficult video that will require you to do without your stupidity for a while. After this video, you can reclaim your stupidity back, just like how the proximal convoluted tubule reclaims its bicarbonate back. With that being said, now let's get started. So in previous videos in this playlist, we have talked about normal kidney physiology, at least the proximal convoluted tubule, as well as Fanconi syndrome, what happens when the proximal convoluted tubule is damaged, as well as a mnemonic about Fanconi syndrome. We said F you Fanconi in a previous video. By the way, genes can mess with your proximal convoluted tubule, and we call this Fanconi syndrome. Medications can tamper with your proximal convoluted tubule, and we'll call them carbonic anhydrase inhibitors. Generic name, Acetazolamide. Trade name, Diamox. Limited supply only, call 5555555. Limitations and restrictions apply. It's a joke. So I've talked about the proximal convoluted tubule and its normal physiology before, so I'm not gonna repeat myself. Just remember the proximal convoluted tubule reabsorbs about 2/3 of almost anything. Your metabolism secretes acids, so you will have lots of acids floating around. Let's get rid of the acids and put first things first, like the effective people in Stephen Covey's book. So, do you want to wait to get rid of this acid until the distal No, first things first. Let's get rid of this ugly acid at the first segment called the proximal convoluted tubule. Okay, in the proximal convoluted tubule, do you want to wait until the other border? No, the first border. We need to get rid of the acid as the luminal border, not the basolateral border. Okay, here's another thing. Because your metabolism secretes acid, your body has an alkaline reserve. It doesn't have an acidic reserve because you don't need it. You need only an alkaline reserve to catch all of the excessive acids. Normally, the proximal convoluted tubule goes like this. CO2 is here. Let's get the CO2 plus water, carbonic acid. By the carbonic anhydrase, we have bicarbonate plus hydrogen. First things first, let's get rid of this acid at the luminal border in exchange of sodium. This is called secondary active transport, also known as sodium-hydrogen exchanger. So the carbonic anhydrase gave us the bicarbonate and the acid. We get rid of the acids in the urine becomes acidic. We reabsorb or reclaim the bicarbonate into the blood becomes more alkaline. This is normally. How about the chloride? The chloride is negative, and this acid in the blood, those protons are positive. Chloride is going to follow the positive. This is called electroneutrality. You can also call it the law of attraction from the movie The Secret. The proximal convoluted tubule has the best solution for acidosis. It gets rid of the acid and reclaim the bicarbonate in one step, which is awesome. All of this was normal physiology. Wait until we introduce a carbonic anhydrase inhibitor to inhibit this carbonic anhydrase enzyme, and all of this is gonna be weird. No hydrogen is gonna be secreted, no bicarbonate is gonna be reclaimed, and chloride will not follow the hydrogen. Also, since protons are not going to the urine, sodium is not going to the tubular cell. Sodium is gonna be lost in the urine. When sodium is lost in the urine, water is gonna follow sodium. This is called osmosis. Hello, that's why acetazolamide is a diuretic, because the definition of a diuretic is something that gets rid of water, but it gets rid of salt and water. That's how it's a diuretic. Let's introduce acetazolamide. It's a diuretic. How? Because sodium is now being lost in the urine. Water is gonna follow. You lose salt and water in the urine. That's a diuretic. It inhibits the sodium hydrogen antiport, the second reactive transport. Yes, indeed. Why? Because it inhibited the carbonic anhydrase enzyme. And when this happens, you will have consequences because actions have consequences. Inhibition of this carbonic anhydrase will lead to decreased bicarbonate reabsorption. Yes, indeed. Now, bicarbonate used to make the blood alkaline. No one is going to make the blood alkaline now. You will end up with acidemia or acidosis because you have lost an alkali. When you lose an alkali, bicarbonate, you have acidosis. It's like your soul. Your soul has a good part and an evil part. When you lose the evil part, you become more good. When you lose the alkali, you become more acidotic. When you inhibit the carbonic anhydrase, you will decrease hydrogen ion secretion into the urine. Hydrogen ion, we used to get rid of this hydrogen ion in the urine. Oh, now it's gonna stay in the cell and go into the blood and will end up with acidosis. So this is gain of an acid. Both loss of an alkali as well as gain of an acid. No wonder acetazolamide causes metabolic acidosis. Next, when you inhibit this enzyme, chloride is no longer following this hydrogen. Chloride secretion will decrease. We call this hyperchloremic metabolic alkalosis because you will have more chloride in the blood now because chloride is not being lost in the urine. When you have more chloride in the blood, we call this hyperchloremic. And you already have metabolic acidosis. Put the two words together, hyperchloremic metabolic alkalosis. Ooh. In the good old days, carbonic acid used to dissociate into bicarbonate and hydrogen. Not anymore. So carbonic acid is gonna accumulate. In the good old days, you used to reabsorb sodium and secrete hydrogen ions. No more. You'll have decreased sodium reabsorption. Sodium is gonna fall in the urine called natriuresis, called diuresis. That's why acetazolamide is a diuretic, because water follows sodium. #osmosis. Carbonic anhydrase inhibitors such as acetazolamide or dorzolamide will lead to decreased bicarbonate reabsorption. You will end up with acidosis because you have lost an alkali. So, this alkali is being lost where? In the urine. You will end up with an alkaline urine called alkalinization of the urine. I'll make a video about this called salicylate toxicity. Next, you are no longer secreting the hydrogen ions. Those protons will go into the blood, causing metabolic acidosis. What kind of metabolic acidosis are we talking about? You can call it normal anion gap metabolic acidosis. You can also call it hyperchloremic metabolic acidosis. Why? Because you have decreased chloride secretion. Next, you will have increased carbonic acid accumulation. You'll have decreased sodium reabsorption and therefore increased sodium secretion. Water follows sodium called osmosis. You'll end up with diuresis. That's why acetazolamide is a diuretic. It's not the most powerful diuretic, but it's a diuretic nonetheless. Acetazolamide is a diuretic. It increases urinary sodium. Agree? Agree. It increases urinary bicarbonate. Agree? Agree. If you increase sodium and bicarbonate in the urine, you are decreasing sodium and bicarbonate in the blood. It's called common sense. Because when you lose something, you no longer have it, which is a philosophically profound statement. Acetazolamide will increase chloride in the blood. Agree? Agree. That's why we call it a hyperchloremic metabolic acidosis. Acetazolamide increases hydrogen ions in the blood. That's why it's a metabolic acidosis. And when you have increased chloride and hydrogen in the blood, you have decreased chloride and hydrogen in the urine, called common sense. If there is something here that I want you to remember forever, it's the fact that acetazolamide causes a normal anion gap metabolic acidosis, or NAGMA. Acetazolamide is a diuretic. Agree? Agreed. Therefore, we can use it to treat hypertension because it's a diuretic. You can use it to treat intracranial hypertension because it's a diuretic. Where do you think the pressure in your brain came from? from the pressure of your blood in your system, honey. We can use acetazolamide to cure glaucoma. Where do you think your intraocular pressure came from? From the pressure in your systemic arterial pressure, honey. And acetazolamide knows how to decrease all kind of pressure. It's a pressure reliever because it's a diuretic. Next, acetazolamide causes metabolic acidosis, NAGMA if you will. If you have metabolic acidosis, you have acids in the system. Now the kidney is screwed because of the acetazolamide. Now the lungs are gonna work to get rid of the acids because you have acidosis. The acid that the lungs deal with is called what's that? My brain frozen. CO2, carbon dioxide gas. You will hyperventilate and deep breathe, called cosmal breathing, like this, to try to get rid of this acid. You're washing out the CO2. This is good because you're getting rid of this acid called CO2, and in the meantime, thanks to the hyperventilation and deep breathing, you might as well increase your oxygen level by breathing it in. O2 in, CO2 out, and this is cosmal breathing. I think I'm a stupid idiot. Here is your normal proximal convoluted tubule. Here is your proximal convoluted tubule under the influence of carbonic anhydrase inhibitors. Normally, you reabsorb sodium via secondary active transport with the hydrogen, sodium and hydrogen out, but under the influence of acetazolamide, you have decreased reabsorption of sodium. You'll end up with hyponatremia. There is no sodium in the blood, and therefore there is more sodium in the urine, called natriuresis or diuresis. Next, the normal proximal convoluted tubule reabsorbs bicarbonate. With acetazolamide, you have no reabsorption of bicarbonate. Bicarbonate is lost in the urine. When you lose an alkali, you end up with an acidosis because minus negative is positive. The normal proximal convoluted tubule used to secrete hydrogen. No more with acetazolamide. That's why you end up with metabolic acidosis, because hydrogen is staying in your system. Therefore, acetazolamide causes NAGMA. This is the only thing that I want you to take from this video. Acetazolamide routes of administration. PO, which means per os. The os here being your mouth, not any other os. Second is IV. It's also available as eye drops instead of your precious crocodile tears. We call this topical use. It's called topical, which means for external use only. Don't swallow the eye drops. And this is called topical, not tropical. This is not a geography lecture. Get your head out of the equator. It's hot there. Acetazolamide is a diuretic, therefore it will decrease systemic arterial pressure, which is good for hypertension. A diuretic will decrease the pressure in your labyrinth, which is your inner ear, and this is good for Meniere's disease. A diuretic will decrease intraocular pressure. It's good for glaucoma, baby, glaucoma. By the way, what's the definition of glaucoma? If you are a mediocre student, you'll say, glaucoma is an increase in the intraocular pressure. Okay, shut up. Even your grandma can say this definition. The actual scientific definition of a glaucoma is, it's damage to the optic nerve fibers caused by an increase in intraocular pressure. Now, this is called science. Acetazolamide is a diuretic and it will decrease the intracranial pressure, therefore it's good for intracranial hypertension. By the way, watch my video on Cushing reflex, one of my most popular videos ever. Clinical uses of acetazolamide for glaucoma. Why? Because it decreases the aqueous humor production and therefore decreases the intraocular pressure, IOP. For long-term treatment for open-angle glaucoma and short-term treatment for closed-angle glaucoma, because you'll need surgery called iridotomy. Irid is from iris, and tomy means to cut. That's why it's called anatomy, because we cut you up in anatomy. Iridotomy is when you remove pieces of the iris to relieve the pressure, and this is called science. Unlike the garbage juice cleanser that you bought online. Next, post-surgical reduction of intraocular pressure. Same concept. It decreases the intraocular pressure because it's a diuretic. Why it's a diuretic? Because it gets rid of sodium and water, #osmosis. Meniere's disease. Why? Because it's a diuretic. It decreases your labyrinthine pressure, if there is a such thing. Idiopathic intracranial hypertension. Why? Because it's a freaking diuretic. Altitude sickness, also known as acute mountain sickness, and we'll talk about this in great detail in the next video. Systemic hypertension, because it's an acetazolamide, it's a diuretic. Drug-induced edema, because it's a diuretic. CHF, because it's diuretic, and in CHF you're full of water, to put it mildly. You have edema in your ankle, you're full of water. You have increased jugular venous pressure called jugular venous distension, because you're full of water. You have distension of the liver capsule of glycine, because you're full of water. Next, you can use acetazolamide to treat metabolic alkalosis, because this guy causes acidosis, so it will balance out the alkalosis. Brilliant! You can use it to alkalinize the urine, because instead of reabsorbing bicarbonate like normal, now you are getting rid of the bicarbonate in the urine, and bicarbonate is an alkali, it's gonna alkalinize the urine, which is good, by the way, sometimes. Why? Because you can clear out uric acid, any acid. Why? Because if you want to get rid of the acid, you put it in an alkaline medium. And again, I'll talk about alkalinization of urine later. This alkalinization of urine is also good to treat the toxicity of aspirin and methotrexate. These guys are weak acids. If you want to get rid of weak acids, put it in an alkaline medium and you will pee it out. It's magic. If you want to be more sophisticated, okay. Idiopathic intracranial hypertension is also known as pseudotumor cerebri. Okay, pseudotumor cerebri. So in your exam, one of the uses of acetazolamide is to treat pseudotumor cerebri. Why? Because it's a freaking diuretic. It will reduce the cerebrospinal fluid and lower the pressure. Alkalinization of the urine. In chemistry, like dissolves like. It's a famous rule. In pharmacology, like reabsorbs like, which is a rule that I've invented. It's an actual thing, but I've named it like reabsorbs like to make it easier for you. Okay, we're talking about the kidney here. Acetylsalicylic acid, also known as aspirin, is an acid. It's a weak acid. If you put it in an acidic medium, like reabsorbs like, it's gonna favor reabsorption. You will reabsorb aspirin. Aspirin is gonna end up in your nice blood. However, if you put this aspirin, which is an acid, in an alkaline medium, it will favor secretion. Aspirin will end up in the urine and you will pee it out. In cases of salicylism, which is aspirin toxicity, you have lots of ASA in your blood. Let's get rid of the aspirin. How do you do it? By alkalinizing the urine. Why do you alkalinize the urine? To get rid of this acid in the urine. How do you alkalinize the urine? By using the great sodium bicarbonate, or historically we used to use the acetazolamide, but this is historically, we don't use it anymore. If you ask a conspiracy theorist, he'll tell you it's because of the big pharmaceutical corporations. Hey, shut up. Now we are using sodium bicarbonate, which is cheaper than acetazolamide, so shut up. Alkalinization of the urine will increase ionization of weak acids. Ooh. Therefore making them water soluble. And when something is water soluble, the kidney can deal with it and eliminate it. It's like sodium chloride. Why is sodium chloride water soluble? Because it's ionizable in water into sodium and chloride. Is sodium chloride water soluble? Goodness gracious, stupidity has no limit. Look, brother, no matter how broke you are, I'm sure you have some table salt in your house. Get a teaspoon of table salt, sodium chloride, and put it in a glass of water, H2O. Start stirring it and then drink it. It's salty, right? Yes. What happened? Sodium chloride is ionized and therefore water soluble. Therefore, you can taste it through your nice taste buds, and therefore the kidney can eliminate it. Why do we use acetazolamide for acute mountain sickness or altitude sickness? This is going to be the topic of the next video. By the way, it's a fantastic video. You don't want to miss it. So please subscribe and join the tribe and save this playlist. It's called Fluids, Electrolytes, and Acid-Base Disturbance. Side effects of acetazolamide include drowsiness, paresthesia, type 2 renal tubular acid. Oh, wait a second. Okay, so here is your nephron. Okay, the capsule, and then proximal convoluted tubule, loop of Henle, and then the distal convoluted tubule. Believe it or not, type 1 renal tubular acidosis affects the distal convoluted tubule. Type 2 renal tubular acidosis affects the proximal convoluted tubule. How about type 3 RTA? It doesn't exist, baby. How about type 4? Type 4 is low renin, low aldo. And that's it. Boom. This is how it's done. Alkaline urine. Therefore, it can precipitate calcium phosphate stones because these calcium phosphate stones love to precipitate in an alkaline medium caused by the great acetazolamide. Acetazolamide makes your blood acidic and your urine alkaline. That's why nowadays we don't use acetazolamide to alkalinize the urine. Has nothing to do with the big pharmaceutical corporations. What do we use now? Sodium bicarbonate, the good old sodium bicarb. Sulfonamide derivative acetazolamide is a sulfa drug. Therefore, patients who have sulfa allergy are gonna be allergic and hypersensitive to that, so don't give it to patients with sulfa drug allergy. Severe hypokalemia. This will affect the muscle, including the heart muscle, and causing disturbance to the AKG, including the famous U wave and other stuff. Here's the summary of this video. Acetazolamide causes NAGMA, normal anion gap metabolic acidosis, also known as hyperchloremic metabolic acidosis. Acetazolamide, you have acidic blood and alkaline urine. It's called common sense. How do you know about the diuretics? Okay, let's talk about them. First thing, you look at the potassium. If the potassium in the blood is high, it's only one class of diuretics capable of doing this. It's called the potassium sparing diuretic, such as spironolactone, eplerenone, triamterene, amiloride. If the potassium is low, you have three options. You have the carbonic anhydrase inhibitors, the loop diuretics, and the cyanide. Next, you should look at the bicarbonate. Who wastes the bicarbonate in the urine? The famous carbonic anhydrase inhibitors, such as acetazolamide. If the bicarbonate is low in the blood, it's boom, acetazolamide. If it's high in the blood, it could be loop, it could be thiazide. You look at the calcium. With thiazide, calcium thrives. So you have increased blood calcium with thiazide and decreased blood calcium with loop diuretics because loop is lose. Quiz time. The most common therapeutic use of carbonic anhydrase inhibitor is... Let me know down below in the comment section. Thank you so much for watching. Please subscribe and join the tribe. I have more than 95 cases on Facebook. Please follow me on Patreon to get the rest of the cases as well as all of my PDF notes, including today's lecture in a PDF form, which you can download and save for you forever. Thank you for watching. As always, be safe, stay happy, and study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.